up, Nurse Fam? Nurse James here. And I know a few of you have some exams coming up and maybe the NCLEX, so we're going to go over a few topics here. I'm going to start off with shock. Now, shock is a life-threatening condition of inadequate tissue perfusion that leads to hypoxia and organ dysfunction, as you guys already know. If untreated, it progresses through predictable stages, that being the compensated stage, the decompensated stage, and the refractory stage, aka the irreversible stage. BKA, bro, you out of luck, bruh. Alright, so the first stage, compensated shock. Now this is also known as the initial stage, and by definition, what it is, it's where the body activates compensatory mechanisms to maintain perfusion despite decreased effective circulating volume or cardiac output. Some of the clinical signs of the compensatory stage would include restlessness, anxiety, tachycardia. Now these are early vital sign changes, so pay attention to them. Cool skin, pale skin, their capillary refill will be greater than 2 seconds, and their blood pressure will still be normal due to the compensation that's going on in stage 1. Now, the nursing priorities that are super important would be O2 administration. You need to make sure your patient's IV access is patent just in case fluids or some type of blood products are ordered. You also need to make sure you monitor their vitals, their urine output, and their LOC closely. Now, for stage 2 of shock, that would be considered the decompensated stage, also known as the progressive stage. And by definition, this stage is where the compensatory mechanisms fail in the body and tissue hypoperfusion becomes obvious. Some clinical signs that you might notice in stage 2 would include hypertension with the systolic of less than 90 and a MAP of less than 65, an altered mental status. Your patient might exhibit confusion, agitation, also weak 30 pulses might be an indication, as well as tachypnea or rapid shallow breathing, oliguria, and cooling clammy skin. Except in the case of early septic shock, then you might experience warm skin for them still. Now, some of the nursing priorities for stage 2 would include oxygen and airway management, rapid IV resuscitation, that would include normal saline, LR, aka lactated ringers, or blood if there's hemorrhage going on. Okay, so third stage, aka, bruh, you really might be out of luck, bruh. Also known as the refractory stage or the irreversible stage. Now, by definition, this is a prolonged hypoperfusion. Now, some of the clinical signs of stage 3 would include unresponsiveness. Your patient might have slipped into a coma, God forbid, severe hypertension, refractory to fluids, and vasopressors. Your patient might exhibit molted skin, cyanotic skin, anuria, weak or absent pulses, so make sure you're checking them, and respiratory failure. So keep your eyes open. Nursing priorities for your patient in stage 3. You want to make sure you provide supportive care, comfort measures, continue their O2 and their vasopressors if ordered, as well as family support, and prepare for poor outcomes because unfortunately stage 3 they don't really recover too much from, so prepare for that. So a key mnemonic that I like to use to help me remember the different stages of shock would be the triple C's. I don't know if some of you are old enough to remember when triple C's was a real thing down in South Florida, but I think of those and it helps me remember. So first C would be compensated stage. Second C would be your crash stage, and your third C is can't come back stage. Now for the compensated stage, that's when your body is coping. You might not notice immediately what's going on. Then would be the crash stage, also known as the decompensated stage. That's when your blood pressure starts to fall. And then the third stage would be the can't come back stage or the refractory stage.